to be performing a low-dye taping technique to my patient, and this is going to be on the plantar surface of the foot. And a low-dye taping technique can be applied to the patient if he may have plantar fasciitis. He could have a pes planus foot, which may also cause patellofemoral syndrome. So what we want to do is raise that medial longitudinal arch with this taping technique. And this particular technique was performed in a study titled Identification of Individuals with Patellofemoral Pain whose symptoms improved after a combined program of foot orthosis use and modified activity. And the results of this study suggested that patients with patellofemoral pain syndrome who had a forefoot valgus alignment of greater than 2 degrees, passive great toe extension of less than 78 degrees, and a navicular drop of less than or equal to 3 millimeters were most likely to respond favorably to this taping technique, or also off-the-shelf orthosis. So I'm going to perform this, and then I'll grab the camera and show you what I have done. So first, I'm going to have the foot in a kind of neutral, pretty much neutral position with the toes. It's going to be passively flexed, so passively flexed on my chest here. And I'm going to go from the first metatarsal head here, providing tension to wrap it around that calcaneus or heel. So I'm going to wrap it around, and then I'm going to come back to where I started. So I'm going to end where I started. So it's going to be on that first metatarsal head, just like this. Okay. And now I'm going to take another strip. I'm going to go from that second, or work laterally. So I'm going to go from medial to lateral here. It's kind of just overlapping a little bit. That tape. Once again, put tension towards the calcaneus, wrap it around the heel, come back and finish where I started. Making sure that tape does not touch the arch, or the medial longitudinal arch of the foot, because we want to try raising that arch. So here I'm going to go from the third. Around. And on the second. That was the fourth strip, beginning on the fourth metatarsal head, ending on the fourth metatarsal head, just working laterally like I said before. So here, overlapping, around the heel, and back. Okay, so I'm going to have my patient here hold the foot position, just like so, and I'm going to bring this over. Okay, so that's the first part of this taping technique, and then I'll perform now the second part. So here I'm going to take the full roll. The first one was just strips. I'm going to take the full taping roll, and I'm going to work lateral to medial. So here, I'm going to pull medial. Lateral to medial. Closing the bottom, covering the bottom of the foot. So here, just like that. And then I'm going to have my patient flip over, and then I'm going to close it. So hold it right there. So I'm closing the shoe. All right, and that's low dye taping technique.